This week, a Louisiana House committee voted for a bill that would allow the state to charge people who have abortions with homicide. The bill also allows criminal homicide charges for anyone who aids an abortion. It also changes the state's definition of a person to include any fertilized egg, potentially criminalizing things like in vitro fertilization and certain forms of contraception. Beyond that, the law would allow the Louisiana legislature to ignore court rulings that it disagrees with. The measure was approved in a 7-2 vote just 2 days after the Supreme Court's draft decision to overturn Roe v. Wade leaked. It's perhaps the most extreme piece of legislation to arrive in recent days, but it would not be the last or the most deviously creative. On Thursday, the Tennessee governor, Bill Lee, signed a law that increases the criminal penalty for distributing medication abortion through the mail or through telehealth. It makes providing medication abortions a felony, punishable by a $50,000 fine. The only exception is for prescriptions made by a doctor in person. Now, the new law is particularly notable because medicated abortion is poised to become a major battlefield in terms of reproductive rights if Roe v. Wade is knocked down, as it's expected to be. Since 2020, medicated abortions have accounted for more than half of all abortions performed in the United States. Take a look at this chart. Their popularity has increased since the start of the pandemic. The pills do not have to be taken in a clinical setting. Patients can take them in their own homes. They're discreet. It's a 5-day course of medication that can be mailed in an ordinary, unassuming envelope. So there's every reason to think that this option might become increasingly popular in a post-Roe United States. Add the fact that last year, the FDA allowed the medication to be prescribed via telehealth and distributed by mail. In December, the agency made that COVID-era rule permanent. It's no wonder, then, that 19 states, many of which have these trigger laws on their books, ban the use of medication via telehealth, these abortion medications by telehealth, or require the patient receiving the medication to be in the same room as the provider when taking the pill. Talk about control. A new battleground in the fight over reproductive rights, one that is potentially about to become even more contentious and important. Joining us now is Christy Pitney, a D.C.-based certified nurse midwife who worked with a variety of organizations related to telehealth abortion and prescribes the abortion pill in that capacity. Ms. Pitney, thank you for joining us tonight.
Thank you for having me.
You've watched, I put that chart up about the very steady increase in the use of medicated abortions. Help us understand why abortion medication has become more common among people seeking abortions, and talk to me a little about the safety of this for the patient.
Yeah, so we'll start with safety. It is absolutely a safe option for folks. There's new research since the pandemic that shows that it is as safe as going to a clinic for a medication abortion. And then the increase in the usage rate has a lot of different factors to it, some being that people just had no idea that this was an option before now, and we're seeing more and more coverage of it. That and the additional fact that it's more accessible in terms of the FDA removing the REMS, and so we don't have to do in-person dispensing anymore.
So there's this issue with these states who are talking about regulating this or regulating it. It seems like something that's relatively easy to get around, given that it's something that can be mailed to someone. How would that affect you or others like you in states where it's restricted if the state said you can't do this?
Yeah, that's a great question. So I'm licensed in 6 states, and I'm only serving in those 6 states. And I would not be able to start prescribing into other states at this time. However, there are bills being introduced. For example, Connecticut just signed their bill. I think it's HB 5414 that is putting protections in place for clinicians to start to prescribe over state lines in this manner. Additionally, I work with an organization, Aid Access, that was started in March of 2018 by Dr. Gompertz, who's an Austrian-based doctor who prescribes these pills to all 50 states. And we were able to bring on U.S. clinicians with the REMS changes, but she's going to continue to prescribe the pills into all 50 states, regardless of the SCOTUS decision, because of her international standing and the fact that she's able to follow all of her legal and medical requirements where she's based out of.
So we now, obviously, with the pandemic, we saw that every time there was something that seemed like a medication or a vaccine came out, they were in short supply at the beginning. In the next few weeks and months, once the Supreme Court makes an official decision decision about Roe v. Wade. There's a likelihood that we'll see a surge in people seeking medicated abortions. Are you thinking about that and planning for it? And do you know what the preparations for that look like? Because obviously there's going to need to be more supplies and more access to people like you.
Yeah, so we're already seeing a huge increase in demand for these services. I can go into numbers a little bit if you'd like, but I can't speak for the manufacturers. However, I believe that they've seen this coming and they've been preparing for it. So everyone that I've spoken with says that they're not anticipating a shortage. We did see that early in the pandemic. However, I think that we're planning far enough ahead that it shouldn't be a problem in these times. And
your sense is that, obviously, in these conversations, people are being made aware of this in circumstances where they otherwise weren't aware of this, and that's been part of the growing trend?
Absolutely. So, prior to SB8, there was some information coming out about these services, but not that much. And then as of September 1st, I really think that has picked up significantly.
Christy Pitney, thanks for joining us. Thanks for letting us know about something that so many people don't know about. Christy Pitney is a certified nurse midwife. She works with a variety of organizations related to telehealth and medicated abortions. We appreciate your time tonight.
Thank you so much.